Hello, Anthony, and welcome back to Freedom Philosophy TV.
Hello, thank you for having me on your show.
Today we're going to be talking about healthcare, or what we call healthcare, and I think we're going to be deconstructing that a little bit and presenting something a little bit more rational. But first, I just want to talk about trends in disease, what we've got in the UK, and I think this is a fairly global phenomena for societies that have become very westernized and have well-developed economies. Because people are having less children, there's basically an aging population. There's these baby boomers as well, and they're not well people. They've got these degenerative diseases, and the size of or proportion of that population that will have two or more degenerative diseases is rapidly increasing, and the size of the population who are in productive work and able to provide the resources to care for this increasingly ill population is on the decline. So there's a real financial problem with the welfare system when it comes to healthcare. So what we're going to talk about today is some potential solutions to this, or different approaches, and just go through them and hopefully get some clarity. So you mentioned the US model versus the UK model. Could you elaborate a little bit on that dichotomy? What's the difference?
Well, there's perceived to be a dichotomy in the idea that America's healthcare system is very free market and that UK's health system is very public. Obviously, neither of those are essentially true. In America, the American Medical Association's Council on Medical Education was founded in 1904 and immediately closed down 25 medical schools, and then another 10 medical schools in the next 3 years. So that was 35 medical schools in 6 years, I believe. And everyone wants to be a doctor, but because of the prestige of being a doctor, but there's high turn-away rates at all the medical colleges, which are actually based on school grades rather than the skills that are necessary to perform well as a doctor. So, we all understand supply and demand. If you limit supply of healthcare, then the price of healthcare goes up. And that's only some of the ways that the state intervenes in healthcare in the United States. There's lots of subsidization through Medicare and Medicaid, and when they last increased that service, that was intended to make healthcare affordable to poor and elderly people. In short order, over 10 years or so, the price of medical care in the US tripled. So a lot of state intervention in the healthcare system in the US. Another thing is we have these insurance companies, and with good reason, people are worried about insurance companies providing healthcare. But the regulatory system is a state apparatus. It's not a free market apparatus. So when these abuses that happen with these insurance companies in the United States, it's really the state that's responsible for regulating them, and it does so in such a way that it makes it very hard for them to provide affordable service. For example, if someone's already got a pre-existing condition and they go to an insurance company, the law says that the insurance company has to take them on anyway. Now, that's just like actually asking for fire insurance after your house is already burnt down. people will start saying this sounds like a very incompassionate way of looking at healthcare, but I think by the end of this, understand that our models for healthcare are extraordinarily compassionate, and we actually really do care about people and want to see them getting better care. Obviously, the problem with getting fire insurance after your house is burned down is the insurance company has to anticipate the costs of that and pass it on to their customers, which is why one of the reasons why healthcare insurance is so expensive in the United States. It's also a highly regulated industry, and if we know anything about history, actually the way to make products very cheap and affordable is to make them so abundant that they become cheap. You know, this is why we all have laptops and things like that, because a computer used to be something that only very, very rich people could afford. Now everyone has a phone, and often most people have a smartphone that can do things that, you know, the people who landed on the moon, they couldn't have even dreamed of having technology that good to land on the moon as what you have on your smartphone. You know, so what we really want is a lot of people in the market. We don't want highly regulated markets that favor established hospitals, established pharmaceutical companies, established everything. We need to have lots of healthcare provision. You know, it takes 7 years to train to be a doctor, but does everything a doctor do need 7 years? Probably not. People who studied 7 years to be a doctor should be doing expert tasks, and there should be graded systems, not what we call in economics barriers to entry, which stop people from going into the industry. We're told every year here in the UK that oh, we're treating more patients than ever before. As far as I'm concerned, that's a disaster. In a universal healthcare system, we'd find that we were treating less patients and less patients because everyone was getting more and more healthy. What we have is a medical system of sickness, both in the US and the UK. The only thing that's remunerated is being sick. You pay for an operation when you're sick, or the government pays for an operation when you're sick. If you go to the doctor saying, I'm just coming in for a checkup every month, you know, he might think you're some kind of hypochondriac. So, first of all, it's not healthcare, it's a system of sickness. The only thing that's remunerated is sickness, and that's true both here and in the United States. Second of all, it's not universal. If you look at actually what's going on, it's rationing. Some people get services and some people don't. There's long waiting lists. People can go into A&E with an appendix that's about to burst and end up waiting overnight or God knows how long before they actually get a bed. So it's not universal. And third of all, it's not free. You know, neither in the United States nor here is it free. It actually comes at a very, very high cost because market forces aren't at work. If you look at something like laser eye surgery, which is in the private sector, when it first came about, it was very exclusive. Only very rich people could afford it. Now it's cheap. Now most people in this country could save up and get laser eye surgery. We know very similar for plastic surgery, which has had knock-on effects on corrective plastic surgery. It's become much cheaper. There's no reason why the government should be spending more and more on healthcare every year. In a sane system, the price of all the technology will come down and people will be getting more healthy. So the government will need to spend less money on healthcare. People bristle at the idea of a private system, but it doesn't all need to be private. You know, cooperatives can step in, charities can step in, non-profit organizations can step in, volunteering can step in. What we actually have a choice between is whether people want excellent healthcare that's affordable to most people, And when it's not affordable to people, benevolence and philanthropy can step in, or they want free at the point of entry healthcare, which is not actually free, it's not universal, it's not healthcare, and it's extraordinarily costly.
Mm. Yeah, I'd just like to actually introduce a little bit of an anecdote here. I don't want to go too far into these kind of anecdotes, but like if you're like a working professional or a working person in the UK, I think the national insurance contribution, or they call it a contribution, it's of course is an extortive tax. It takes about 10% of your salary. So if you're actually a relatively well person like myself, over the course of your working life, you would have had literally tens and tens of thousands of pounds taken from you, and you'll get potentially no return on your investment. That will be spent on other people who perhaps haven't taken as good care of their health, or have just had something unfortunate wrong with them. And then when you get something wrong, if it happens to be one of those conditions that is rationed, so as say certain types of cancer, or in my case, I might need some special dental care or something like that, then that money is no longer available for me, my own money, to spend on the condition that I actually have, because perhaps it falls outside of the parameters that the state consider essential or high priority for care. And occasionally you do see things in the newspapers about this, but in particular, like in the UK, a lot of dentistry is no longer covered by the NHS. So just to reinforce really your point that it isn't universal healthcare, and it does have to be rationed. And there's still, as far as I'm concerned, a great deal of injustice in the system.
Well, people consider justice to be that everyone gets access at the point of entry. So supposing you are a vegan, you happen to be a vegan, but supposing someone is a vegan and they take lots of exercise, and they don't drink, they don't smoke, they get lots of fresh air, they buy a sophisticated water filtration system so that their water is nice and clear and pure. Now, on the other hand, you have someone who has bacon for breakfast. When they go to work, they go across the road to lunch at McDonald's every day. They like to get really drunk at the weekends. They smoke 40 a day. Where is the justice in this person being able to tax the vegan to pay for his heart surgery? Now, I don't mean to be incompassionate here, because on the other side of the spectrum, where's the incentive for this unhealthy person, this person who lives an unhealthy lifestyle, to take care of themselves? What would exist, hopefully, in a private system that's not modelled on the American model, which, as I've discussed, isn't really private, is this person would have health insurance. Now, just before there was any government intervention in the medical field, in the United States, there were friendly societies where people grouped together to provide health insurance for one another, and you could get a year's worth of health care for 2 days' wages as a labourer. So we're not talking about the cost of healthcare in the US now. It might be slightly higher because of the technology involved, but we're talking about something that's affordable to everyone.
Well, of course,
if you're in that state,
if you're getting into preventative medicine, which is where the free market would take people, you just wouldn't need a lot of this technology anyway. That would be the amount of it that a hospital would need to treat what would become exceptional cases would be quite small. At the moment, what it is that lots of people are exceptionally unwell. They have heart disease, cancer, diabetes, and this affects a huge proportion of modern populations, and they all need this quite intensive and invasive healthcare and drug regimes and so forth. So it's very high maintenance costs and technical investment. And of course, a lot of these diseases are quite intractable as well, because basically the allopathic model can't fix them. Then there's also huge sums being spent on research and the technology associated with that to try and fix the problem, which fundamentally, in many cases, needn't be there.
Right, right, because a lot of it is based on lifestyle choice. So supposing you had this friendly society, or your insurance cooperative, or your private healthcare, or whatever you choose, we're not blocking anything out of the universal model that I'd like to talk about. You don't have to go to a private organization. You could go to one that's not for profit. Whatever you have, they're going to phone you up if you've got an unhealthy lifestyle. Either they're going to raise your premium, or they're going to say, look, we're really worried about you. If you have a heart attack, they need to pay however much it costs, £10,000 for your operation. So they've got an incentive to give you a free helpline, free access to counselling if if you've got problematic habits for psychological reasons. It's cheaper for them to give you a bunch of cheap preventable than to pay for you being ill. Right now, everything's upside down because the system is remunerated for you being sick. In any sane society, the system will be remunerated for you being well. And we all know this. If you had a financial advisor, you'd want to make sure your financial advisor was making more money when you were making money and less money when you were making less money. We want the same with healthcare. And that would be extraordinarily compassionate, because no one knows what the solution is. But if you have a healthcare system where there's an incentive structure that remunerates health, you'll start having all the greatest minds in healthcare being in trial and error with each other, comparing the results to one another to come up with the best solutions. We need to put those incentive structures in place so that it's health that's remunerated rather than sickness, and cheap, affordable solutions will follow through the wonderful trial and error of the free market. Right now, the government says, here's how we're going to do it, boys, and any officiation of the system is slow, grinding process. In the meantime, after hundreds of billions have been spent on the fight against cancer, today more people contract cancer than ever before. And if you do contract it, you have the same percentage of dying as you did in the 70s. More people have diabetes, more people have heart disease, heart attacks, strokes, more people have multiple sclerosis, lupus, asthma, migraines, more people have degenerative conditions like Alzheimer's. So something's gone wrong here. And what we need to do is take a look at the incentive structures implicit in the system and look at how we can create a system that is healthcare rather than sick care, is universal because everyone has access to it, even if it's not for free. Everyone has access to it because it's exceedingly cheap, and where people don't have access, they can get put on a payment plan or go for charity. And it's that's what we're looking at, really.
Yeah, and also, and I think this was particularly true before there was national health care. Doctors, or some doctors, or perhaps even many doctors, would offer free sort of work for very poor people who couldn't afford to pay for it. So, you know, they might go to sort of a poor clinic in some area and just treat people for free. And, you know, I kind of like the integrity of that, because if you think healthcare should be free, then you should give it for free.
Yeah, that's right.
And yeah, also there's the opportunity cost as well. There's first of all, there's a great deal of money that's going into this huge sickness care industry and the pharmaceutical drug industry. That money could have been spent on really enriching people's lives and making more pleasant and positive in other ways, if they weren't ill. And also just being well in its own right is a terrific advantage in terms of productivity and satisfaction with life. So there's, you know, it's just winning all round to have preventative medicine and to focus on that. If that isn't is preventative.
That's right.
Preventative medicine actually sounds like an oxymoron to me, but
Yeah. Well, here's the thing, you know, on a free market, you know, most people here in this country believe that people should have access to healthcare if they need it, even for free. On a free market, that's called a demand. If people want that, then that's a demand. So people have displayed that they're willing to pay for it by voting it in through the tax system, which is very encouraging in terms of where we stand, because that costs a lot of money. I reckon on a free market, expenditure on healthcare would be a fraction, you know, maybe 10% of what we have to spend now, maybe 5% of what we have to spend now. And I do believe that the quality of service would be a lot better. You mentioned a lot of money is on research. Because of the nature of this system, the research is on treating illness. Treating illness. That's because treating illness is what gets remunerated in this system.
yeah.
If what was being remunerated in this system was health, then most of the research would be on optimal health. Now, once you have that research going on optimal health, very soon people know how to assess any human being in all the ways necessary and give them a tailored plan for how they could optimize their own health, because that's what the experts in the field would largely be doing. Then you give them a premium based on how well they follow the plan.
Yes, exactly.
And, you know, this could be exceedingly cheap, actually. You know, maybe if they follow the plan, they only have to pay £20 a month. Okay, I don't know anyone who can't borrow £20 a month if they can't pay for that. If they deviate from the plan, then, you know, the premiums start going up. But at the same time, because the organization doesn't want them to be ill, because if they get ill, they have to pay out more money. As I said, they could start providing them free monthly checkups. Maybe that's part of their plan. Maybe the plan says, we will provide you with free monthly checkups. If you don't attend a checkup, you'll have to pay an extra £20 for that month, or something like that, or, you know, whatever. Start giving people the incentives to take care of their health, and we will see a thriving community. As you said, there's an opportunity cost. All these resources that are being spent on healthcare services, they could be spent on people eating better, people having nicer things in their house. You know, you just need to go to the supermarket and see how expensive fruit and vegetables, which are the building blocks of health, are compared to confectionery. The price of confectionery has gone down and down and down, and the price of fruit and vegetable, which are the building blocks of health, has gone up and up and up.
Yeah, well, I think there's a problem with the fruit and veg. As far as I understand it, a lot of it used to be picked by low-wage immigrant labour that would come into the country during the sort of harvesting season and pick it. And then with the introduction and increases in minimum wage, that practice has become less economically viable. And so the costs of production for fruit and vegetables have instead of declining, have risen. And of course, that's going to have knock-on effects for people that are on the borderlines of being able to afford a healthy diet. Even slight increases in price will push them below and into unhealthier diets. And then, of course, there's all the increasing in cost of the healthcare that follows from that. So it's a complete malinvestment, basically. And again, of course, it's an attempt to regulate the free market that just backfires.
As it so often does. I mean, I mentioned before in one of our shows that it takes 7 times as much grain to produce a kilogram of beef. So why isn't beef 7 times as expensive as grain? Yeah. Well, because there's massive subsidies for meat and dairy farmers. The consensus on health about dairy, they used to say that dairy was good for you and things like that. That's generally not acknowledged in health anymore. People think that dairy is very, very bad for you. And, I'm not saying that I personally am a vegetarian, you're a vegan. I'm not saying that, people eating no meat, eating any meat is going to kill them or anything. What we do know is that most people in this country eat far too much meat. 24 of the 25 leading causes of death, 24 of the 25 leading causes of death, you are more likely to suffer from those illnesses if you're a meat eater, and 12 of them can be treated by a plant-based diet. That means if people have them already, if they switch to a plant-based diet, which means not just eating chips and all sorts of unhealthy food and bread and things like that, but actually eating proper plant-based diet, they can actually seriously lower their symptoms. So by subsidizing the meat, we have people eating far too much meat and dairy. In the old days, maybe when my grandmother was alive, they maybe have chicken once a week. Fine. People are eating too much of unhealthy foods, and as you've illustrated and I've illustrated, that's encouraged by government subsidies to the farmer. Yeah. So when the people think that we live in a capitalistic society and it's all free market causing all these problems, but if you look at any sector of the society, people could come to us with any sector of the society, and I'm sure if you and I could point out half a dozen ways that the government has intervened in the market, not to make things better, but to make things worse. I mean, I don't agree in any government intervention in the market. That might make me an extremist, but I would just say that makes me a principled person. But if they were going to do something like that, maybe they could tax confectionery and meat and put a subsidy on fruit. But then 5 years later, you and I would be having a conversation on this show saying, the government tried to do a good thing, which was to tax sugar and subsidize fruit, and all the unintended consequences have been this environmental disaster, that. In every case, I'm sure, no matter how the government intervened in the market, there would be some unintended consequences that you and I could have a show saying, I wish they hadn't intervened in the free market because it's created an environmental disaster or a health disaster or an unemployment disaster. The wonderful thing about the free market is it's a self-optimizing system. Yeah. People can look at what's in place and look for a way to improve it and come in and provide a better service, and then people will go to that service. And then if there's a problem with that, someone can look at that and say, oh, look, no one's seen that this is causing this problem. Well, we can create a product that's even better than that. It self-optimizes itself over time. You get none of that when the government comes in and says, here, boys, let's run it this way.
Well, let's talk a bit about what we do get and what we have. Yeah, there's something quite interesting that I hear Stefan Molyneux speak about in his programs about sort of socially funded programs. And it's something like this. Basically, if you start talking about challenging the privilege of the medical cartels and the the doctors, the nurses, and the pharmaceutical drug industry, if you challenge that, basically they're going to face consequences of losing a fortune, losing a lot of money, and seeing their market dry up. And that means doctors' salaries are going to fall. Potentially, nurses' salaries might fall. I mean, we don't know. Perhaps they might actually go up, but there would just be fewer doctors and nurses. It would just be a structurally different market. But undoubtedly, there'll be a lot less drugs sold. So that's going to have a very severe ramification for those sectors of the market that are currently privileged by state protection, essentially. Whereas the taxpayer is really only seeing, a few pounds a month taken away from their income. So there's an imbalance of incentives there. It's like the tiger chasing the deer. The tiger is running for its dinner, and the deer is running for its life. And in this case, you can see that the people involved in the healthcare industry are not quite running for their lives, but they've got a lot more invested in manipulating and controlling the market than somebody who's like, well, okay, I'm losing £100 or £200 a month, whereas in a private healthcare system I might just lose £50 a month or 20 or something. So that there's this disparity of extreme disparity of incentives that the government creates in the market, and it's very difficult to resolve that. I can't see how we step up to it's like we just need to take responsibility for ourselves to change this around. Have you got any ideas about that?
Yeah, well, I mean, that's quite a profound point. Like, how do we turn the tide on this? A couple of things have been in the media about. There's a article called Labour's Private Hospital Stitch Up, where they exposed how they tried to privatize the management of an NHS hospital, and they did so well. The hospital did so well. Even down to little things like getting furniture from Argos instead of wherever they were getting it before, and they saved so much money doing so that they could then channel to helping patients. But they went and did an investigation, and the people who did the investigation were had close ties to the Labour Party and unions which oppose NHS privatisation, and they basically did a stitch-up job where they tried to make it look like this hospital was performing exceedingly badly when it was performing exceedingly well. You can check out the article yourself. It's very long, and so can your listeners. So every now and then something comes in the media and points to the fact that our National Health Service isn't what it seems. It sounds like a great idea, it's compassionate, everyone gets access to healthcare, until you start speaking to people who've gone in there, and you said, the people in the profession are incentivized to protect this. I would just like to qualify that. I think there's a lot of doctors and surgeons, I would say the vast majority in there, who are doing a good job based on what they've been taught. But they've been taught the mainstream medical paradigm, which is all about treatment. It's not about prevention. That's what they're trained to do. And I've heard people go in there who are very in favour of the NHS, coming out saying, I cannot believe that's what people are fighting to defend. And it's sad. It's so, so sad, because they feel a betrayal of them personally, that they were, they were so in favor of this, and they went in and, they had a condition that could turn critical at any point, and they had to wait days to get a bed. So I think that the people in there are well-intentioned. I'm not sure about the big pharmaceutical companies and the people who sell all the kidney dialysis machines and things like that. They've got a lot of vested interest in keeping things as a medical service of sickness rather than health. But to answer your question of how we turn the tide, we have to start with this podcast. The level of education for alternatives is very poor. I've gone around and had a bit of a look, and there's a couple of things on the internet, but someone will need to take the points that we've made and do another podcast that includes another 10 points that we didn't think of, and send it to us and educate us, and let's start having a free market of information. In the meantime, people need to step up and realize that just because if it's free at the point of entry doesn't mean it's free. And if you take that attitude and don't take care of your health, then it's not going to be free, because you're going to pay in terms of your quality of life. So start adopting a healthier lifestyle. Sure. And I just see a possibility where practitioners are paid for maintaining the health of a reasonable number of clients. Now, if they do a good job, whether they get paid every month, and if they do a good job, then they can take on more clients. Whereas if they do a bad job, then they can only see business. Yeah, they can only see so many people at a time, because their clients are constantly calling them, I'm ill, I've got this. Another insane thing in the incentive structure I forgot to mention before is every medication has side effects.
Correct.
And then you get medication to medicate your side effects. And because we have a system of sickness, not a system of health, there is no need for health practitioners to really look at whether it's herbal or it's pharmaceutical, whether it's allopathic or whether it's alternative. What is the best treatment that creates the least amount of side effects? Because if that enters a spiral in treating the side effects, that's more money for pharmaceutical companies. They love that. Let's sell you a pill for your effects, and then let's sell you a pill for your side effects, and then the side effects to the side effects. That's good. We actually need to be looking at a system that would remunerate health, and just start having conversations with people and telling people that it's possible. It's possible to create a system of health than sickness. And even if people hate privatization, you could still do this in a status system. You could still get the government to start looking at paying practitioners. Yeah. That's not an ideal solution, but it's a step in the right direction.
I agree. I think I'm a little bit more skeptical about the good intentions of the sickness care profession. I think you mentioned the AMA at the beginning of the show, and this is basically a industrial lobby, just a more upmarket, if you like, union to protect the interests of doctors. And obviously, if doctors were just pure and well-intentioned, they wouldn't be going to create these essentially cartels to protect their business and to raise the costs of becoming a doctor and so forth. And it's similar with I think with the nurses in the NHS, creating these huge unions that in turn fund the Labour Party and the big welfare parties, which is essentially just cronyism. I mean, it's no different from the pharmaceuticals protecting their turf by paying off politicians and buying them nice meals out with representatives and so on and so forth. It's exactly the same in principle. And yeah, I just wanted to point out that I don't think the healthcare workers have a squeaky clean and completely moral and above board position. I think there's cronyism there, and I think it's important to point that out.
Yes, very possibly, and you can only look at people in a case-by-case basis.
Sure.
I think the real problem here is the religion, the ideology behind the NHS, which is stuff like what I talked about in that article. Labour's private hospitals stitch up shocking evidence of how the left sabotaged NHS success story. There's this ideology of public. It's not public. Nothing is owned by the public. There's no such thing. Either you have control over property or you don't, and certain people have control over the property. It doesn't belong to you just because the government says it does. There's this religion, and it's immune in many people to being challenged. It's just a principle. Oh, NHS, it should be free for everyone. And they care more about that ideology than people's lives.
Yes.
And you can chuck all sorts of arguments at them, and they just don't care. They just don't care. Or it's an ideology. But the thing is, it needs to be done enough times that it's acceptable, because you do not change someone's mind in one conversation, and you do not usually change people's minds. You change the minds of a community. One-to-one, people tend to be a lot more open-minded than in groups.
Sure.
And you need to have conversations with people, and their other friends need to have conversations with them, so that this view becomes an acceptable view. Because right now, you don't care, you don't believe in NHS, people think you're heartless.
Yeah, that's
right. I've got a clean conscience because I've dedicated my adult life to trying to find the best ways to help other people.
Yeah.
I'm not a heartless person. I care about people getting access to high quality healthcare and being healthy. But if you say you care about the poor and you care about health, then you're going to look at the real world evidence of what creates health and what creates affordable health care, not put your ideology of NHS above people's health care. And I think that's what people do. They put their ideology above the real world evidence of what actually creates good health. And I suggest that anyone Google an article called "How the Government Solved the Healthcare Crisis"
I'll put a link
for an analysis.
Yeah.
For analysis of how the government stepped in and made the provision of healthcare much more expensive. So
it's a great story. I wanted to talk a little bit here and be a bit topical as well, to talk about the Baltimore riots and what's going on over there. And I've been reading some articles recently about Baltimore, and of course it's a liberal stronghold and has a very welfare focused policy, basically to supposedly help the underprivileged classes. But the reality of it is that after, I think, nearly 5 decades of welfarist intervention, they have some of the worst educational standards and some of the worst health outcomes for any Americans, and even and in terms of employment as well. I mean, they're worse than places in developing economies. I mean, they're shockingly bad outcomes for people, and yet they have a very high degree of public intervention or socialization going on, and millions of dollars poured in to try and improve the situation, and yet it just gets worse and worse. And this is just what we're seeing in the UK as well with our healthcare. Just more and more people are ill. And like you say, people are wedded to the ideology and not to what the data is showing them.
Yes, that's correct. And I'd just like this to be a resource for waking people up a bit and just showing them an alternative. You don't have to agree with everything we've said, but it should open you up to looking into it more. And if you see this, share it with your lefty friends, share it with your friends who are in the mainstream, and get a discussion going with them. Even if you completely disagree with everything I've said, send it to your friends and ask them to give you more fuel to disagree with it, and leave them in comments so that we can see where people who support the NHS are coming from, and get a dialogue going. It's not the end of the conversation. Get a dialogue going. Let's put our heads together, because if you disagree with what John and I have said, then you can give us more information and we can process and learn from that and come back to you with a response. And if someone's watching this and thinks they could do a better job, a better deconstruction of health, of this so-called free universal health care, which is not free, it's not universal, and it's not healthcare, please put another video out that's even better than this one and educate people, because there needs to be a good resource on YouTube that when anyone is supporting the NHS, there needs to be a good resource on YouTube that when anyone is coming out in favour of the status quo, people can say, check out this video, it's an hour long, it compiles good arguments. I think this one might be one of the leading resources on that topic at the moment. If someone can create a better one, then fantastic. This needs to be an ongoing dialogue. We need to give people hope. It's not about just speaking about how terrible the present system is. It's about talking about how much better a system we can create.
Yeah, I agree. I think one of the things that comes up for me quite a bit is even to dare to challenge the ideology, you face the flamers and the trolls and the shamers, who will accuse you of all kinds of heartless, being incompassionate, and so on and so forth. Which of course is completely projection as well, because anyone who treats you like that is obviously quite lacking in empathy and compassion themselves. But nevertheless, that for me is still I think I hold back a bit from really challenging people and saying, well, I mean, just look at the numbers, just look at the bare costs of how this system and what it's going to cost if we don't change it in the next 20 years. It's just going to be unaffordable. I mean, it's just going to collapse.
Yeah.
It has to collapse.
And we're all, and how much do those people who say, oh, you don't care about the poor, and put their ideology of this system, how much do they care about the poor if they're sleepwalking off a cliff? You're supporting a system which is going to leave, God knows, maybe millions of people dispossessed. I'm sorry that it's gone so far, but people, when you look at the well-known free market advocates, whether it's Milton Friedman or anyone, they were hated. They're still hated.
That's right.
That people don't like their ideology challenged. Okay, perhaps Ayn Rand wasn't a very pleasant person, right? I believe Milton. Yeah, but the thing is, people hate them because they challenge this view that the government can just give people things and it won't have any unintended consequences. But the information necessary, I'm not married to those two figures. I just mentioned them because they're the best known. They gave good information on certain incentive structures and certain elements of economics. Each of them did. I'm not saying anything of them was right about everything or anything like that. people hated them. They didn't take the time to listen and understand where they're coming from. And there's no need to hate on someone if they're wrong, you know, and
Yeah.
you know they're wrong. You just provide a better analysis.
That's right.
But whenever you see these people talked about, it's always in moral terms. They always talk about how horrible those people were. They never actually deal
Just for
with the
having an
nitty-gritty. Rarely ever deal with the nitty-gritty of their argument. And I'm sorry that it's gone so far, simply because there's been an excellent analysis of economics from the Austrians, Ludwig von Mises, F. Hayek, and these are people that people have never heard of.
Yeah.
All the information's been there. Murray Rothbard was writing all the way through the 20th century. The information has been there. And people either hate on the people who support it, or they don't bother to read up. They listen to, there's this left-wing echo chamber in academia where everyone's a left-winger, or the vast majority of people are. So instead of talking about whether socialism is correct, they're all saying, see, when we have a socialist state, should it be run this way or should it be run this way? Should we do it this way or this way? This imaginary state that doesn't exist, they're debating that. They're debating tiny elements of policy, and they're not actually going to Milton Friedman, Hayek, Rand, Ludwig von Mises, Murray Rothbard, Tom Woods, an amazing contemporary historian, Walter Block, a great economist and philosopher, you know, and really studying up these arguments and you know, you don't have to agree with them, but at least know what you're talking about. You don't have to come out and say, you know, capitalists are pigs and things like that. You can say, well, you know, those advocates of capitalism attest this, but actually, blah blah blah. You know, be well informed. Be well informed. Don't put ideology before empirical evidence.
Yeah, there's certain kinds of habits there. I mean, it's basically intellectual dishonesty, and there's also a great deal of magical thinking, and a lack of critical thinking, really, to just, you know, go to the other side of the argument and hear what other people have to say that conflicts with your views. The unusual and I think the strange thing is, of course, you know, people on the left or the liberal side will accuse others of being closed-minded and, you know, fanatical, and yet they won't pick up these books or read these articles. And in particular, I think one of the biggest issues for me when I deal with people like that is that they're not prepared to have a criteria that falsifies what they claim. You know, you say, well,
yes,
how can I prove you're wrong? You know, tell me how I can prove you're wrong. And they just don't have an answer to it. You know, the answer is always, well, yeah, that didn't work, but we needed to spend more. Or you know, we need to have this policy instead. And of course, these are just more unfalsifiable retorts, basically, that just fuel the fanaticism and the faithiness of these people. It's
yes. Really so I ask, you know, if you are a person on the left, first of all, I really commend you for listening to the whole hour. But yeah, please drop us a comment. Say, what would you need in order to change your mind and stop supporting government healthcare? You know, let's have some criteria here.
Yeah, absolutely. That's I think a salient point to start closing this program on. I think we've covered all of our points there. I'm just going to check the list there. Yeah, I think we've done very well. So thank you, Antony, for engaging me again in conversation and getting over your points really clearly. And yeah, hopefully we're not going to come over as completely smug and cold-hearted. I certainly don't think we come over like that. So yeah, I'd be interested to hear people's opinions on that as well. And yeah, once again, thank you for giving your time.
Thank you for having me on your show again. And I look forward to continuing our partnership.
Yeah.
There's one more thing I'd like to say to people who are listening, which is whether you like it or not, your healthcare is your responsibility. Even though the NHS is free at the point of entry, your healthcare is still your responsibility. If you do not take care of your health, it's not just money that's at stake. You're going to have a lower standard of living. So, a free marketeer might say, your healthcare is your responsibility, and you say, well, no, it's the responsibility of the community. It should be provided by the government. Even though it's provided by the government, it's still your responsibility. You're the person who's going to suffer if you don't take care of your health. So, get a juicer, eat more fruit and vegetables, limit consumption of things that you know that are bad for you. You stand to gain. Do 20 minutes stretching a day, go out for a bike ride, walk up the side of a mountain. Whatever you enjoy, find out a way that you enjoy of looking after your health, and do that with your loved ones. You can make it fun, and we're all responsible for our healthcare because we're always the ones who are going to suffer if we don't take care of ourselves.
Yeah, thanks for pointing that out. It's a great, another great closing point. And for me, that just brings up quite a bit of sorrow around people in my family that have suffered for decades with chronic ill health and have died prematurely, won't be seeing their grandchildren. I mean, the negatives are, just talking about the money and the corruption, just the personal consequences of not caring for yourself are absolutely colossal.
That's true. And I'm sorry to hear that about your family, John. And, I feel there's psychological health there when people don't take care of themselves. And it would be nice if there was more awareness of that in our society. And if you know people who don't take care of themselves, please take some time to listen to them with curiosity and not moralize them, and hear what it's like for them and where they're coming from and what they're thinking. Not to moralize and to start criticizing them for bad habits, but to maybe gently challenge them and take a lot of time to listen to what they have to say.
Yeah, definitely create a connection with these people. And yeah, I'm sure there's probably a program's worth or a piece in there about self-esteem and so forth, and prior traumas and all the rest of it. But perhaps another day. So bye for now.
Absolutely. Bye. Thank you for having me on your show, John. Take care, and thanks everyone for listening.
Yeah, thanks for listening. Bye for now.